Hello, my name is Bertha, and this is week 11 MRI video of the shoulder and wrist. So, before I start an MRI scan, I'm going to demagnetize and I'm going to make sure I remove all my jewelry, my watch, my cell phone, keys, wallet. I'm going to make sure I have nothing metal on me or on my clothing before I enter zone 4, which is the scanning room. So I'm going to go ahead and do that, and then I'm going to enter the scanning room, and I'm going to place gloves and grab some hand sanitizer wipes to wipe down the coils that I'll be using, which will be the dedicated shoulder coil. And then I'm going to wipe down the emergency squeeze ball, the headphones, the scanning bed, and I'm going to set the things I'm going to be using aside so they're easy accessible within reach. I'm going to put fresh linen, a new pillowcase, and I'm going to lower the scanning bed as far as it can go so that the patient has easy access onto getting on. And once I've done all those things, I'm going to walk out of the scan room, close the door behind me, and then I'm going to go grab my patient. Once I have my patient in the scanning room, I'm going to have them lie down supine head first in the scanning bed, and then I'm going to place the dedicated shoulder coil on them, and their arms are going to be set by their sides, and their hands are going to be either positioned supine or neutral, and my landmark is going to be the shoulder joint, also known as the glenoid fossa. For the axial sequence planning of the shoulder, I'm going to plan the axial slices on the coronal plane, and my slice angulation will be perpendicular to the joint space and on the coronal image and perpendicular to the humerus on the sagittal. Slice coverage should cover superior to the acromioclavicular joint and into the shaft of the humerus or deep into the axilla. For the coronal sequence planning, I'm going to plan my coronal slices on the axial plane, and my slice angulation is going to be parallel with the supraspinatus tendon, and my slice coverage is going to cover the whole shoulder joint from the anterior portion of the coracoid process to the two slices posterior to the humeral head. And for the sagittal sequence planning, I'm going to plan the sagittal slices on the axial plane. My slice angulation is going to be perpendicular with the supraspinatus tendon. And then my slice coverage is going to be from the deltoid muscle, two slices medial to the glenoid. Now for the scan of the wrist, we're going to set up the same way we set up for the shoulder. So basically demagnetizing and setting up the scan room. So we're going to do that repeatedly for each exam. So the first thing I'm going to do is grab the HD wrist coil, and I'm going to instruct the patient um, to lie down prone head first with hands raised up, which will look like a Superman position. And then I'm going to place my landmark at the carpals. For the axial sequence planning, I'm going to plan the axial slices on the coronal, and then my slice angulation is going to be parallel with the joint space. My slice coverage is going to be from the metacarpals to the radius and ulna through the entire wrist. For the coronal sequence planning, I'm going to plan the coronal slices on the axial plane. My slice angulation is going to be parallel to the radius and the ulna and the carpals. The slice coverage is going to be from the dorsal to the palmar aspect. And for the sagittal planning, I'm going to plan the sagittal slices on the axial plane, and then my slice angulation should be perpendicular to the distal radius and ulna. My slice coverage should be skin to skin, side to side.